Well, good morning. It's been about 3 months now since we had our last peer sharing call, which was just a few weeks after our action planning session. And I talked with most of you, or most of your healthcare organizations in the meantime, and I know that you've all been hard at work doing things. And that's what we're here to do today, is to take and share with our fellow participants what you've been doing with your projects. Many of you are very far along, and a lot of you have completed them. We have roughly 50 minutes here, and so each of you is going to have about 10 minutes to take and share what's been going on with your projects. And if you have a visual you want to share, go ahead and screen share. Otherwise, we'll just have you talk to us and tell us about the good work that you're doing. During our time together, or during the time that you're sharing, we'd like you to introduce yourself. And if there's more than one of you from the same healthcare organization here, to take and share who else is joining you. Update us on your major happenings and your work and your progress toward your majors or your goals. And I'd like to know if any of you have, in the last couple months, drawn in some new people to be working with your project, whether they be community persons or other persons from your healthcare organization. And then ask any questions of the group, or allow the group to ask you questions. Does all that make sense? All right. Do I have a volunteer that would like to start? Otherwise, we'll go in alphabetical order. Okay. Taylor, do you want to start?
I sure can. I am just getting my pictures up there real quick to see because they're kind of small on my screen. So yeah, I sure can. Can you hear me okay?
Yes, we can. And are you sharing a screen right now?
Not at the moment.
Okay. All right.
But
all right.
maybe near the ending of my talk.
Okay. All right. That sounds good.
So this was a new event to our facility. I guess I can start with who I am. My name is Taylor Savanash, and I am the new foundation director here at St. John St. Alexius Medical Center in Canton. So this was a new event to our hospital, and it was very exciting. And so going into it, we were like, you know what, we're just gonna set our expectations low and see how it can grow. And we were kind of blown out of the water with that. Our attendance, it was incredible. It was greatly attended. And so we had advertised for it, you know, on the radio and the newspaper, on Facebook. And we didn't know how the community would necessarily respond because it was kind of a gloomy day. It wasn't the warmest out. But the attendance was great. And so we actually ran out of food completely. And then the vendors that we had for the project, we actually met our goal and went a little bit over it as far as vendors. I had done a fishing book, and so I didn't get to personally see all the different vendors or write them down. I didn't meet of them, but it was a great sight to see all the kids. And there was, I mean, it wasn't only kids, but there was adults and everyone was participating. So that was great to see. We did invite some new community members in if they wanted to join, and so we invited them into our meetings. It's great to kind of see them come in with their ideas and incorporate those. The school participated quite a bit, and that was helpful to see because obviously working with those kids every day, they were able to bring in some helpful ideas. And then yeah, our goals were absolutely met and exceeded for that event, and we hope to continue to spread positive Is there anything you would like for me to add or any questions that anyone might have?
You mentioned that you advertised on social media and the paper, and did could you identify which method of getting the word out worked the best for you?
We couldn't. So Amber, who is it? I know she has been helping quite a bit and been in on these meetings, and so she individually reached out to businesses, of course, for door prizes. And I think word of that actually really kind of expanded. And so those businesses shared like, hey, you know, there's another health fair going on. You should go and attend this. And then also I think having the school involved really helps that participation also. I'll see what the best method here is to kind of show you different photos. Showing up on downloads here. These are some of Amber's photos. So right here we have an inflatable train and they're doing face painting. So those are some of the few things that we incorporated. We had the high school students doing face painting and, you know, a lot of grade school students.
Taylor, we're not seeing the pictures. We're seeing your computer menu or your hard drive or your,
Okay.
your list of pictures. So,
okay. How about now?
There you go.
Got it? Okay. Thank you for that.
Yep.
My apologies. So, there is a big inflatable train right here in the center. We had an inflatable horse. It had those kind of hamster balls, if you know what I'm talking about. I should have some additional photos in here of those. And it was this horse that two people could race on. So that was a huge hit. The line was going the entire time. And then we have face painting, and so the high school students were the ones to do the paintings. And this really brought in the grade school students because you see these people in the high school and they're like, oh, I know that, let's go over there or let's start a conversation with them. So let's see, they're gonna let me pull up another one. I'm kind of new to this whole screen sharing thing, so here are those hamster balls and the course. And so I even actually tried this out just to make sure that taller people could interact with this, as I'm 6'1", and it worked for me. So even adults could interact with this. Okay, are you able to see this photo? Okay, so this right here was our eating area, that gray building with the roof. And so it was nice to have coverage, you know, like I said, it was a gloomy day and had been raining. And then our booths were to the right. We had 11 of them. And so what we had was they had a passport and they went to each booth and the vendors then stamped their passport to account that they were able to get the information that they were showing at the booths. There's some more booths. We were able to have the ambulance there and have that open, which could select to go in and see. And then some different kind of therapy booths that are there at the end. And there was a lot of adults who were really drawn to that just to learn more about the services that they offer. There's another one of hamster balls and that track, and then there was also an inflatable archery, and it was completely rubber, so it was safe. And then they shot down balloons, which was really neat with kids as well. Here's that fishing booth, and so they took the fishing pole And they had brought it over the sledge here and then had prices on the other side that they fished for. That was a hit with the kids. They loved it. And I had quite a few multiples coming back and ran out of prizes, so. And then lastly, this just kind of includes everything. We did have a reading station on the left side. That wasn't the biggest hit, but it was helpful, you know, that it was right here at the park. So when kids wanted to interact or go, you know, on the jungle gym or whatnot, get a break from the booths and the different games going on, that was nice to have them to be able to interact with things. That's kind of the consensus of all the photos. But yeah, if you have any other questions, I can go ahead and answer.
Can you tell us a little bit about who were vendors besides the ambulance and?
Yeah, so like I said, I had worked at the fishing booth, and so I didn't get to see a lot of them. I know a few of them off the top of my head. Amber has a better answer to that, and I know she'll be popping on later in the meeting. So I'll write that down for a note to have
Okay.
her give that to the entirety of the list. I know we had a therapist from our community and just share with some of the services that she offered. There was a speech pathologist, she came. I believe there was someone who assisted with some sleep studies or something along that line who helped. Let's see, we have a, you know, like a walk for suicide each year. And so they had a booth there. And yeah, in total, we had 11. So, I'll make sure that Amber gets you that list.
Okay. And then I'm gonna ask you something that isn't on our list is what is, since you've completed this, what is your next thing that you're working?
So I know that we're gonna have a follow-up meeting coming up to kind of discuss the pros and cons of everything that we did, what can improve it. Going forward, I'll share a little bit about myself. So I've been here at the hospital for 3 months now. And so, I don't exactly know from here on out what the goals are of the next step.
Okay.
And we'll have one.
You're going to work on mental health first aid.
What's that?
You'll be working on mental health first aid.
Okay.
Putting that on, and I just want to have you jot a note down. Nicole Threadgold sent, probably not you, it probably she probably sent it to maybe one of the other 2 team leads since you're new, some funding for mental health first aid. So I just wanted to point that out.
Thank you. Yeah.
So, yeah, I'm pretty sure she sent it to Jody, but with Jody being out, and it would be in the top, it'd be in the very bottom of her inbox when she comes back. So I just wanted to let you know that, to ask her to be looking for that. There's I think it's some North Dakota funding for that, if I remember right.
Yeah.
So,
okay.
All right.
Absolutely. I will ensure to bring that up, and then I will have Amber include that list again.
So since I've been asking the questions, does anybody else have any questions that they want to ask Taylor before we move on to Alyssa?
You said you had great attendance. Do you have a number of people that attended?
So we handed out, I think it was close to like 250 plates. And so we kind of based it off of that. We didn't allow for seconds because we didn't know if we would have them. And so, yeah, there was around 250 plates handed out. So we kind of roughly estimated that. It would be nice in the future if we had a better way to figure that number. Just get it more accurate. that's for sure something that we would add to our webinars.
Yeah. Thank
And
you.
their goal was 100.
Oh, okay, you definitely exceeded that.
Yeah, I was going to say it's really good turnout, and I was wondering too, did you hear any chatter from people that were attending, any kind of feedback or reactions to the experience?
Yeah, so it was great because we had door prizes that we had drawn for them at the event. Initially, we were gonna draw after the fact, but people were waiting around and we're like, you know what, I think this is a good time to do this. And so we went through that, and then those who couldn't be there, we contacted them and had them come, meet us here at the hospital. And so that was a great way to hear, some feedback, because they said, our kids had a great time. We had a good time. We didn't have as many adult groups, and I think that's something that we can kind of hold in for next time. But we heard a lot of feedback, and all of it was very positive.
Great, good.
Thank you. Thanks for the question.
Any other questions? Then Alyssa, I will turn it over to you to hear what has been happening in Montreal.
Okay, my name's Alyssa Zahn. I'm a nurse who works at Montreal County Medical Center in Stanley. So for this project, our main goal was to improve our substance abuse screening system, as well as increase our access to behavioral health and substance abuse services within our community. So the main things we wanted to do with this project was add a behavioral health service into our clinic and our emergency room, market more with the community about our behavioral health services, create a substance abuse screening tool within our emergency room, and provide resources for people who have substance or alcohol abuse, provide them with resources where they can get help. So the first thing we did was we came up with a list of resources available in our community as well as in Minot for people who either have substance abuse, alcohol abuse, or mental health issues. So we made up a brochure that we are able to hand out to anybody who might have those issues on places they can reach out to for assistance. We also did create a substance abuse screening tool for our emergency room nurses. So right now that screening tool is on paper. We are still working on how to incorporate that into our EHR so that it can be easier to charge for our nurses. But right now we do have it on paper. So we are still just currently working with our electronic health record IT people to try to get it into our EHR. We did add on a behavioral health telemedicine service in our emergency room. So we went live with that in March, and that's been going really well. Along with that, we had to educate our nurses and providers on the new service and create some new policies, but all of that has been done since March, and it's been going really well in our emergency room. We did add in a telemedicine service into our clinic. We've had that for about a year now, so that's not something new. But with this project, we did want to work on the marketing for that. So it was either April or May, we had a mental health awareness month for our community. So we did a lot of education in the newspaper. We did a lot of education on our social media pages. And then we also had some kind of education / advertising that we did within our facility on mental health, as well as the services that we offer here for mental health. So that is completed and went well. So yeah, those were our main 4 areas, and I guess we are done with everything, and I think everything's been going well. The only thing is just incorporating that substance abuse screening tool to our EHR.
Anyone have any questions for Alyssa?
I do, yes, actually. Boy, that was a lot of work in a short period of time, because I know it's sometimes complicated, just even building out policies and procedures. So that's really impressive. I was wondering what kind of response you're getting from the ER, like staff or providers, because sometimes it's a little mixed. So just curious, and how you guys are dealing with, if you're getting pushback, how do you deal with that? Just wondering.
Well, I think the reason we were able to finish it so quickly is because we have been working on this for a while. We've been talking about it for years that we need more behavioral health services in our facility. So we did really just start with all of this back in November, but it has been something we've been talking about for years. Also with our behavioral health telemedicine service in the ER, we're using Avell, and we already have them for our I can't think of the word, but we've had Avell for years already, so we already had a relationship with them, so that was pretty easy to get going since we did have a relationship. And we didn't get any kickback at all from our providers here. They all know that this is something we really need. We see a lot of behavioral health coming through our emergency room, and whenever they come through, it's like, well, we don't know what to do with them. Like our providers here aren't trained in that, so they were all happy that we were going to be offering this service.
Yeah, so a couple things come to mind. One is when providers and everybody's bought in, one of the, I don't know if it would be measurable, but anyway, one of the outcomes is improved staff satisfaction, just with and engagement. So that's a really big deal if there's an opportunity for you guys to even somehow measure that later, because that's a big one. But anyway, the other thing I was thinking is when you were saying you guys had been talking about this for a while, and one of the things that I've heard that from other hospitals with other states that we've worked with is saying that exact thing, that that the project actually kind of put teeth and actions to the things they'd been talking about. So I'm really glad to hear that that was your experience.
Yeah, it's been good, and I think the reason we were hesitant to do it for so long is because this is costing us money. Our facility is not making money off it, but at the end of the day, it's just something that the community needs and we need. So I'm glad that we finally got it going.
Good for you guys for having that kind of attitude, that sometimes there are other really, really important reasons to do things, and it's not always the finance part.
Yeah, for sure.
Just a question for everybody else on the call. When she says Avell, do you understand what that is and why they're using it? Nope. You want to explain what Avell, how Avell fits into your workflow, or what you use them for? Because that's something I had to learn a few months ago.
Yep. So Avell is a telemedicine company that we've used. I've been here for 6 years. We've had them as long as I've been here, but we basically have TVs and video cameras in our emergency rooms. And since we're a critical access hospital, and we usually only have 2 nurses and 1 ER provider on, if something critical comes in, we're able to just push a button, and then Avell provides us with a nurse and a provider on the TV, and they can watch what we're doing, and they can give orders and document for us, and they can assist with calling around for transfers. So that's just something we've always had in our emergency room for traumas and stuff like that. But we just added the behavioral health add-on to it. So they provide us with psychiatrists that can do actual psychiatric evaluations on patients in our ER, and either tell us yes, this patient needs to be transferred somewhere, or they can go home, which is really nice because previously whenever we would have somebody come in, our providers weren't capable of clearing them. So we would just always have to transfer them on. And it seems like a lot of times when we need to transfer patients, we would have psych patients sitting in our ER for a very long time. And I think since we've added Avell, they've been finding placement a lot easier. And I think it's because the accepting facilities know that they've already been seen by a psychiatrist, so they're more apt to take those patients.
Thank you for explaining that, Alyssa.
And
With
that,
the nods I'm seeing,
and that can be
Yeah,
another good, oh, sorry, go ahead.
I was just gonna say, I don't know what we would do without that service because it adds a lot of comfort, I guess you would say, for our staff. Whenever something scary comes on, at least they know that they have, even if our provider can't be there right away, they can always push the button and there will be a provider on the screen that can still help them.
It's like you're adding workforce in a way, you know, you're kind of helping with that.
Thank you for that explanation, Melissa.
And I wanted to say one more thing, and I promise I'm not even a measures person, like measurable outcomes, but I got to say the other thing that would be a good measure is the number of people that you were transferring just based on that was the only thing you could do. And now that it sounds like there are probably fewer people that are being transferred because you have a different set of eyes to make that decision. And again, that's huge because that's, the transfer takes a lot of sometimes manpower to do. And it's certainly for somebody to be transferred to a different place, if that's not really what they needed, it could be a big cost, it could be a big dissatisfier. So anyway, good for you guys. Just really great impact, I think, for your community.
Yeah, thank you.
Did we have time? I have a question. Is that okay?
Yep, we're good.
I was curious about the screening tool. You said that it was created for the ER nurses. Is that something that was created in-house, or was it taken from another source? I'm just curious in terms of is it a standardized measure that you're using?
Yeah, I don't know the name off the top of my head because our DON in the hospital is the one that came up with it, but it is a standardized screening tool. And previously we were just asking, do you ever drink alcohol? Do you ever use drugs? How often? Kind of just that very basic thing. So
Yeah, I was just curious if it was a standardized tool, because that would be important to have something that has some, research, evidence-based backing to it. So
Yeah.
Thank you.
it is one of those standardized
Yeah.
tools. I just off the top of my head.
I remember, in some of my notes, I probably have it written down, but when they started talking about it in their action planning, it was one that I've heard for quite a few years. So it is, one of those good evidence-based standard tools. All right, let us turn it over to South Central. Stacy and Megan.
In the meantime,
Hello.
Hi, Megan.
Hi, it's Stacy. Came down to my office, so sorry, I forgot that I took my speaker away for something else. So our plan or our goal was to implement annual wellness visits, because in the past we really just have not been utilizing those services. So our initial goal was to just educate the staff and the community about what annual wellness visits even are about, because it can be extremely confusing. Most people still don't understand that it's not their annual physical. It's just a whole visit that we want them to come in for. So that was our first goal, was to educate our staff, which we've done fairly good. We've definitely done a lot of education with the front office to try to explain to the patients what's going to happen during these visits, and that it doesn't replace their physicals that they do every year. And then we've also done a lot of advertising on Facebook and just kind of word of mouth, I guess, just talking to all the patients. The other goal was just to even implement the workflow and to get the proper documentation in our Cerner system, which we finally did get that. And then also just getting the charges and everything set up in the Cerner system as well. So since March, our goal was to have about 15 annual wellness visits a month. And so starting in March, I think we had 19 visits, and then we've kind of since then done about 10 to 15 visits a month, just trying to get caught up. To do that, we've been picking about 10 patients a month to call And then also sending out 20 letters a month just to try to get that goal of 15. Let's see, we've also been starting to work with the nursing homes, going into the nursing homes and just doing a few visits there while our providers there doing rounds. And so like in July, we plan to do about 20 visits just alone at one of the nursing homes. Some of the cons, I would say, I was telling these guys about this last week, is that word does get around in our small town, and so a lot of people that came in to do annual wellness visits realized they had we do mini mental exams on everybody that comes in, and they kind of took offense to that, thinking we were taking away their driver's licenses and like wanting to, you know, do all this stuff. And we really tried to explain to them this is just a baseline. We're not trying to take away any of your rights or privileges or anything like that. But of course they went and told all their friends, don't come, they're trying to take your driver's license. But I think we kind of got around that now and called some people that, you know, the people that had called and said they're not doing it because of this, we did call and kind of explain it to them. Pros though, I think we have had a couple, you know, that we've definitely been able to get a few services for them that, you know, if it's Meals on Wheels versus life alerts, or even setting up advanced directives. Like I do feel like there have been some that have kind of benefited from that. But that's about all I can think of.
And it's a good revenue stream for your healthcare organization.
Yes, we are trying to do, we're trying not to do dual visits. We're trying to do separate visits right now, but we'll see once the end of the year comes how far behind we are on our numbers. But
Does anyone have any questions for Stacy?
I had one question about the mini mental. Can the person refuse to do the mini mental during their wellness visit, or is it something that they have to do?
no, and it is not required. It's just something that we felt would be very beneficial. So
Sure.
we have been trying to do them, but no, that it is not, they don't have to do them if they don't want to.
Yeah, no, I mean, obviously, I mean, it is an important screener. I think that's important to have that included, but I was just thinking in the sense of reassuring people that if there's something part of the wellness visit that you don't want to do, you can always refuse it, so that, you know, at least maybe that'll help with
Right.
that barrier.
A balance assessment is part of it as well, isn't it? Do you do the timed up and go, or
Sorry, say that again.
a balance assessment or the falls assessment part of it?
Yeah, we do a falls assessment.
Okay. Do you use the timed up and go, or what do you use now?
You know, I'm not even exactly sure because it's built into our system, so I'm not sure which one it is that we're using.
Yeah, usually the timed up and go, the tug is what's used. It's a pretty easy one. One for strength is 5 times sit to stand for lower extremity strength. That can be another one for just sorry. I could give you some other ideas. Yeah, but the tug is a very easy one to do. And that's another great place, I think, as a marketing tool would be, you know, fall risk, just, you know, just trying to, you know, balance assessments or fall risk, that if that's part of it, maybe trying to market it to those things that people would want to know in terms of what their fall risk is. I think that can always be something that can bring people in, especially older adults.
Most older adults know that one of the biggest life-changing events for them is a fall. And they want to avoid that fall because they all have friends that have fallen. And that's when you start losing your driver's license. That's when a lot of other things start happening. So yes, you know, come, you know, so you don't want to have a fall. Come to your annual wellness visit so we can make sure that we can help you prevent having a fall, because you know, one of the things you're going to do as a result of finding somebody who's having some balance issues is to get them into physical therapy. Or if you have a falls prevention program in your community, I mean, you know, just those kinds of things that Yes, instead of the mini mental,
Right.
yeah,
Yeah.
go for something else, but.
I would bet that families who have older parents, family members would also be very interested when they heard that you were doing a falls screening for the same reason. And then the other thing, to go back to the idea of the marketing is, all of this is really to help people to kind of have their best life as they age. And so being able to even do the marketing from that standpoint, that it's all about supporting your best health as you age.
Right.
Other questions, other comments? Now, I saw Nicole hop on, and then I think she hopped off right away. Am I right with that, Molly, that we've covered everybody here? Think so?
Yeah, I believe so.
Okay, all right. So think about our time together and listening to all of the project work that you guys have been doing, and thank you so much for sharing what you've been doing. It's just a delight to to be able to share with Rhonda and Anahita the kind of work you've been doing. I've been hearing it along the line, but I kind of feel like a proud parent, I guess, in some ways, that this is the work these guys are doing. So but is there, something about our conversation today, something you heard from one of your peers or a question asked? What is something that really kind of stood out to you, or an aha kind of moment? Just on mute to let us know. And that goes for Rhonda and Precious and Anahita as well.
I'd say for me, like I said, being new to this and so kind of explain my timeline. Jody had came to me and she said, "Hey, do you wanna come to this meeting? It's for a mental health fair that we're putting on." And I said, "Yeah, why not?" And so I came to it, and then they were, it was a meeting almost before they were gonna go ahead with the fair, and so I was pretty late to the game. But seeing everything come together, and now this meeting with you guys, it's kind of a aha moment in my mind, like everyone is looking out for everyone. Everyone wants to care about one another, and mental health is so, so important and underrated. And so I think that is just, it's almost just kind of clicks off in my mind that I'm so thankful for people like you who are taking care of others and looking out for them and looking out for a part of the body that is not treated and not taken as well care of as it should be.
Thank you, Taylor. Taylor also put a list of the different vendors that they had in the chat. So if you haven't noticed that, thank you for doing that, Taylor. Alyssa or Stacy or Megan, have you had any ahas or thoughts about our time together today?
One thing I was kind of taking note of is we do like EMS night out every year during hospital week, and I mean it would be beneficial to probably do kind of what Carrington did with adding some mental health services. We usually just do the ambulance, police, fire, sheriff, like all them have booths, but we could try to implement a little bit more on mental health as well.
Alyssa or Precious, I see you unmuted.
Yeah, So my aha moment was not necessarily in this meeting, but it was about information shared in this meeting about the mini mental health with the getting like older adults to participate. I thought it was so like an aha moment to realize that word of mouth, especially in a small community within a population, is huge, and making sure that you're able to pivot if one approach wasn't working. But yeah, word of mouth is definitely can have such an impact. So
Has a big impact in letting the right people know that you're holding an event too, that word of mouth can really make a big difference in attendance. As you think about your project, what are some things that you are really excited about the work coming up or the work that you have been doing?
I think with annual wellness visits, sometimes you find those care gaps that maybe don't always present themselves in their yearly physical, whether it is Meals on Wheels or other things to help keep them healthy, keep them active, keep them at home, like you said, living their best life in their retirement or their older years. So it's exciting to find what you can do to help people live more fully.
Thank you.
I would say for us, it's kind of both. It was so exciting to see everything come together, but then to learn from that and learn what we need to kind of hone in for next time. But then also moving forward and being able to, as a member who's going to help out with this, give my input on different ideas. And it was also so helpful today to hear others' ideas to be able to move forward with different projects that we can continue to better improve.
Looking 3 years down the road, you've done a lot of work, you're nearing the completion of this project. But if you look 3 years down the road, how do you see lives changed as a result of this work and continued work?
Yes, our goal is that patients can stay in their homes longer, less at nursing home admissions. Just like I said, living more independently is kind of our goal.
Mm-hmm.
For us, I think just the mental health services, that even if we can help a few people who are in a crisis get the help that they need right away, that can make a huge impact on a lot of people's lives in the next few years.
Well, I thank you for joining us today and sharing about your projects. This is our last formal time together. I will be, a few of you I have to do our kind of quarterly, let's check in and see how things are going call yet. I have a few of those to finish up. But then in late July, early August, we'll be really wrapping up all of the details for this project. So you'll have another call from me. And we're going to want you to do things like, you set measures when we were doing our action planning and strategic planning. And we're going to want to kind of know what that measure is. I just happen to have South Central's here on the screen. Medicare wellness exams will increase by 30% from 2023 to 2024. And so just where are you at right now? What is the increase? And that just helps us document the work that we've done, and probably even more importantly, helps your state office document why they had all of you participate in this program. And so anyways, we'll be providing what those measures were and just have you update those. And then a short survey as well, so we can take and be improving the work that we do with this program. So be looking forward to some of those year-end project and evaluative kind of things. And they will not be burdensome. And then I will have another one-on-one closeout call with your organization. So with that, I thank you again. Any other comments from my team before we sign off?
Can I say one more thing and then I'll be quiet, I promise. So the other thing that I was thinking is, I was in the strategic planning with you guys and the action planning, but I don't really get to interact on the month-to-month basis like Molly and Deb do. And so it was so fun to hear all the work you guys have done in a really pretty short period of time. If you think, I mean, it's really maybe 6 months from when you really got into the nuts and bolts of it. So a lot of great work, and I was just thinking too, don't forget to brag on yourselves, put out in your local newspaper or on social media, your website at the hospital of the project, what you did and what you've accomplished. Some really nice success stories to have some little snapshots about. Tell your story. That's really important in getting the word out.
Great. Well, everyone have a good rest of the day. One more day to the week, and then have a great weekend. Take care.
Thank
Goodbye.
you.
Everybody.
Thank you.